All patients deserve to be treated with dignity and respect and have their concerns heard and acknowledged by their clinician. While these are likely goals for both patients and clinicians, patients within the UTI community often report dissatisfaction in these interactions when it comes to UTI care. With the release of our Clinician Education Resource, Improving Treatment Pathways for Patients with Persistent Lower Urinary Tract Symptoms, we want to make sure you have everything you need to have a successful interaction with your healthcare provider when introducing the resource. We worked with our advisors and patient advocates to create an all-encompassing guide that walks you through presenting this resource to your doctor. While these tips were developed with UTI education in mind, they can also be applied to other topics you'd like to discuss with your doctor. You can find a link to download your copy of the patient guide in the description below. The first step in preparing for any appointment is to review what you'd like to discuss with your doctor ahead of time. For the clinician resource, it's not necessary to develop a deep understanding of the information, but rather how the information may benefit your clinician in your care. If you haven't already, check out our video on understanding the UTI clinician resource to learn about the topics included so you know exactly what you're requesting they read. When you have a quiet moment, write down goals you have for the upcoming appointment. The goals that you establish for the appointment will be unique to you, but they may include things such as your doctor agreeing to review a resource you'd like to share with them, ordering tests you feel would be beneficial in your care, or you and your doctor establishing a treatment plan together. When it comes to relaying your health history, it can be beneficial to prepare ahead of time. It's easy to get lost in the details or forget some once you're with your doctor and they begin asking questions. We've included a worksheet in the patient guide to give you ideas as to what type of information to include, as well as a recommendation to ask your doctor how they'd prefer you relay the information, such as chronologically or by listing your current symptoms. Next, write a list of questions you'd like to ask during your appointment. We all know how easy it is to have thought of questions only for our mind to go blank when it's time to ask them. If presenting the clinician resource, it can be helpful to ask questions about your clinician's experience in treating persistent UTI. We've included some suggestions in the guide. Their responses to these questions can help you determine whether or not they may be a good fit for pursuing your goals with you. You can also consider what questions you would like your clinician to ask of you, such as questions around how UTIs or lower urinary tract symptoms have affected your quality of life, relationships, and mental well-being. Our research shows that patients report more satisfaction with their care when their clinician takes an interest in the far-reaching impact of their symptoms. Some sample questions are laid out in the downloadable patient guide, linked in the description. The day of your appointment has arrived. During your appointment, with your prepared goals and questions in hand, thank your clinician for the care they've provided to you up to this point and inform them that you'd like to take an active role in your healthcare decisions and you would like to work with them in a collaborative way to achieve your desired outcomes. Clinician feedback we've received demonstrates that they are more receptive when information is introduced by established patients. Don't let this stop you from seeking care from a new clinician, but do keep it in mind as you approach these conversations. Arguably the most important step, remember that you are your own best advocate. No one will fight for your health like you will. But if you need additional support, bring a close friend or family member who is familiar with your goals. You are responsible for hiring your clinician, and you have the right to be involved in the decision-making process. This may require a shift in your mindset, but it can ultimately transform the role you take in your care. Name drop a bit. Inform your clinician that you're affiliated with a patient education organization and they've shared peer-reviewed papers on the topic of lower urinary tract symptoms. Request your doctor's permission to share these papers with them, offering to discuss them during your next appointment so they have sufficient time to review. At the end of your appointment, revisit your goals and determine if they were achieved. Did you feel heard? Were you active in the decision-making process? If your goals were achieved, thank your clinician and move forward with the plan that you and they created together. If your goals were not met, you may experience feelings of being devalued, dismissed, discouraged, or more. Know that these are completely understandable and commonly experienced feelings. If you're not satisfied with the outcome of the appointment, if it's an option for you, be ready to move on and seek care from a clinician willing to pursue your goals with you. Whether you seek care from a new clinician or work with your existing healthcare team, continue voicing your thoughts and pursuing open discussions in order to achieve these goals. This information can be overwhelming. You may even feel intimidated at the thought of advocating for yourself when it comes to UTI and bladder health. But we hope that the tools we've provided help you prepare for these discussions, understand the value of your voice in your healthcare decisions, and raise awareness of persistent UTI among clinicians. Once again, you can find links to the Clinician Resource and Patient Guide, as well as the video providing an overview of the Clinician Resource in the description below. We'd love to hear your thoughts and experiences using these resources, so be sure to stay in touch. Once again, you can find links to the Clinician Resource and Patient Guide, as well as the video providing an overview of the Clinician Resource in the description below. We'd love to hear your thoughts and experiences using these resources, so be sure to stay in touch.